Bravo pH study.
Areas examined and treated.
Esophagus. Lower esophagus, near reflux area. Acid exposure in the esophagus. Symptom correlation with reflux events.
The procedure.
Diagnostic. This is a wireless acid reflux monitoring study. It measures acid levels in the esophagus. A small capsule is attached to the lining of the esophagus. The capsule sends readings to a recorder worn by the patient. It helps connect reflux symptoms with acid events. Therapeutic. No treatment is performed by the capsule itself. Treatment recommendations are made after results are reviewed. Medication, lifestyle, or further testing may be discussed.
Before your procedure. Schedule your procedure.
Appointment. Schedule your Bravo pH study appointment with GastroDoxs by phone at 832-632-4070 or in the office. Location. A procedure location will be suggested based on your insurance and geographic area. Please refer to the locations page on our website.
Insurance. Our team will obtain the required insurance prior authorization, if needed. Financial. GastroDoxs provider fees will be collected upon scheduling your procedure. Orders. Our team will send your procedure orders to the surgery center. Transportation. Do not plan to drive after your procedure. You must have someone 18 years old or above to drive you home. No Uber, Lyft, cab. Changes. To cancel or reschedule, call or text GastroDoxs at 832-632-4070. Register with the surgery center. General. A representative from the hospital or surgery center will call you to discuss the registration process, time and location of your procedure.
Clinical. The pre-assessment testing team will discuss the following: clearance if necessary, medical history, medications, pre-anesthesia questionnaire, surgical history, pacemaker, defibrillator, or nickel allergy history.
Financial. Hospital, anesthesia, and pathology fees are independent from GastroDoxs. The other fees not related to GastroDoxs are to be discussed directly with the other providers, hospital or surgery center. If you have not heard from the financial representative 24 hours before your procedure, call them at that time. Clearance.
Cardiac hematology, neurology, pulmonary. You may need a clearance if you have high-risk conditions requiring clearance. You may need a follow-up with your doctor or provider before they can issue a clearance. Our team will send your doctor or provider a clearance request from our office. Once our team has your clearance on file, we will call you to schedule your procedure. Tell the team if you have a pacemaker, defibrillator, esophageal narrowing, varices, or nickel allergy.
You may need a clearance if you are on blood thinners or these medications: apixaban, Eliquis; clopidogrel, Plavix; dabigatran, Pradaxa; edoxaban, Savesa; prasugrel, Effient; rivaroxaban, Xarelto; ticagrelor, Brilinta; warfarin, Coumadin, and Jandivan. Medications. Two weeks before. Hold GLP-1 agonist medication: dulaglutide, Trulicity; exenatide, Byetta; exenatide extended release; Bydureon Besice; liraglutide, Victoza; lixisenatide, Adlixin; semaglutide, Ozempic, Wegovy, Rybelsus. Tirzepatide, Mounjaro.
1 week before. Hold, proton pump, inhibitors unless instructed otherwise. Omeprazole, Prilosec, pantoprazole, Protonix, esomeprazole, Nexium, lansoprazole, Prevacid. 1 day before. Hold oral diabetes, medication if instructed. Hold acid reflux, medications as instructed. Insulin. Take adjusted dose if instructed. Procedure day. Blood pressure, medication as instructed by the pre-assessment team. Insulin, hold. Others, hold. Other. Continue to take your medications unless specified below. Blood thinners will require a clearance on file before scheduling if needed. The pre-assessment team, PAT, will review your medications and may make other recommendations also.
Diet instructions.
Two weeks before. Foods. No change unless instructed by your provider. Liquids. Drink plenty of water. 1 week before. Foods. No special diet change unless instructed. Avoid reflux. Trigger foods if your provider recommends it. Follow the medication. Hold instructions carefully. Liquids. Drink plenty of water. 1 day before. Foods. Light meals may be recommended. Stop all food after 12 a.m. Midnight unless instructed otherwise. Liquids. Drink plenty of water until the allowed cutoff time. No alcohol. Stop all liquids after 12 a.m. Midnight unless instructed otherwise.
Procedure day. No food or liquids on the procedure day. Blood pressure medication as instructed by the pre-assessment team. Insulin hold. Others hold.
Bravo recorder instructions. Recorder. Diary capsule. Keep the recorder close to your body during the study. Press the symptom button when symptoms occur. Record meals, lying down, getting up, and symptoms. Do not restart reflux medications unless instructed. Return the recorder and diary after the study is complete.
Procedure day.
Diet. No food or liquids on the procedure day.
Arrival. Please ensure you arrive 1.5 hours before your procedure. You will check in at registration when you arrive.
Pre-procedure. The clinical team will go through the clinical assessment as well as risks and benefits of the procedure. The anesthesia team will explain all aspects before the procedure. Consent forms the procedure will need to be signed.
Sedation. An intravenous line will be inserted into your arm to administer medication. You will be given intravenous sedation medication during the procedure.
Position. You will be instructed to lie on the left side. Placement. After sedation, an upper endoscope is gently passed through the mouth into the esophagus. The Bravo capsule is attached to the lining of the esophagus. The capsule starts measuring acid levels and sends readings to the recorder. Post-procedure. It will take approximately 30 minutes to 1 hour to recover from anesthesia. The clinical team will observe for chest pain, vomiting, dizziness, blood pressure issues, heart rate issue, fever, or swallowing trouble. If you are doing well and have woken up from anesthesia, you will likely be discharged to go home. Diagnostic. The capsule records acid exposure in the esophagus. The recorder stores the acid data during the study period. The diary helps compare symptoms with acid reflux events. Therapeutic. No treatment is performed by the capsule. Treatment recommendations will be given after the study is completed and reviewed. Pathologist. Not usually applicable for Bravo pH study unless biopsies are taken during the upper endoscopy. If biopsies are taken, tissue samples may be reviewed by a pathologist. The pathologist will send the reports to our office.
Follow-up. Our providers will review the report in detail. The findings will be reviewed with you in detail upon follow-up. After your procedure. Recovery. You will be under observation for 30 minutes to monitor for any symptoms. You will be awake within 30 minutes but may still be groggy for 12 to 24 hours. Do not plan to drive the remainder of the day after your procedure. Transportation. Do not plan to drive after your procedure. You must have someone 18 years old or above to drive you home. No Uber, Lyft, cab.
Symptoms. Normal post-procedure symptoms. Mild sore throat. Mild chest discomfort. Awareness of the capsule. Mild swallowing discomfort. Mild bloating or gas. Abnormal post-procedure symptoms. Severe chest pain, trouble breathing, trouble swallowing that is getting worse, vomiting blood, black tarry stool, fever 100, severe abdominal pain, any other severe or unusual symptoms. Please call 911 and go to the nearest emergency room.
Appointment. Ensure that you have a follow-up 2 to 3 weeks after the procedure. Results. Your results will be discussed in detail. Treatment recommendations will be given. Questions. Call or text GastroDoxs at 832-632-4070. Thanks for watching.